Well, now I want to focus on an issue that's a top issue for many voters, the increase in health care and prescription drug costs. NBC News' Ann Thompson explores one facet of that, so-called combination drugs, how they're contributing to the rise in costs of prescription medicines.
Perfect. Love it. Love the art. So let's focus on the art.
Suzanne Luddig is a freelance photographer in Omaha.
Nicely done. Love it.
But she works a second job as a teller because it comes with insurance to afford her acid reflux medicine, a generic version of Zegrid. That insurance has saved her a whopping $14,000 for a 90-day supply, according to her pharmacy receipt.
It was immediate relief.
She's taking what's called a combination drug. Zegrid is one pill that combines two over-the-counter medications, generic Prilosec and sodium bicarbonate, also known as baking soda.
I don't understand why when you have Prilosec and baking soda and you put those two together, why does it all of a sudden become $14,000? I don't get it.
They get away with it because they can. They can set drug prices based on what the market will bear.
Dr. Hannah Sachs, an internist and medical researcher at Mass General Hospital, says combining two medications into one should not be so expensive. She studied the price difference between brand name combination drugs and their generic components. Take Zegrid, $86 per pill versus 47 cents for the two generic ingredients. Vimovo, an arthritis pain reliever, $30 per pill versus 35 cents for the generics. Duexis, another pain reliever, $20 per pill versus 28 cents.
These are small tweaks on existing medications that have been around for decades in some cases, and that doctors have known and been using for these purposes for years.
Her study found that brand name combination drugs cost Medicare close to $1 billion. Is there any kind of magic to these new combination drugs?
Magic? No, there's no magic. The way I think about it is, in a lot of ways, we're paying for the repackaging here.
What's more, list prices for some of these combination drugs have skyrocketed. Duexis, $139 for a month's supply 8 years ago, tops $2,400 today. Most patients and even doctors have no idea. How do these costs remain hidden?
The costs remain hidden because a physician, when they're prescribing, may not know exactly how much a drug costs. When the patient goes and picks it up at the pharmacy, they only know what the copay is.
Suzanne Luddig's copay, for example, is just $24.
So if the patient doesn't realize it, and the doctor doesn't realize it, and yet behind the scenes, all of these price hikes are unfolding.
Another example, Vimovo's list price has gone up 10 times over the years, a jump of 2,000%.
In the first 3 months, we also had about $34 million in revenues.
Tim Walberg, CEO of Horizon Therapeutics, which makes Vimovo and Duexis, declined our request for an interview. The company told us patients don't pay the full list price. Out-of-pocket cost for 98% of insured patients is $10 or less, and that the company nets less than $300 for each prescription. But it adds up. The two drugs have brought in more than $1.3 billion in 8 years. Over that time, Walbert's total compensation by the company, which makes several drugs, more than $50 million. Horizon also says providing pain relief and a stomach protectant in a single pill is better for patients.
I can see the convenience in taking one pill instead of two for some people. The question here is at what cost?
If patients are paying so little out of pocket, why should they care?
Because this is a cost that we all have to pay. This is part of the reason for the rising cost of prescription drugs and the rising cost of healthcare in this country that we all have to care about.
The maker of brand name Zegrid declined to comment. The maker of the generic version said many factors go into the cost of a patient's medication. And if you're wondering whether you should take two cheaper generic drugs instead of one expensive combination drug, that's something you should discuss with your doctor.
That was NBC News' Ann Thompson. Ann, thank you very much. We'll be right back. You're watching MSNBC.